Summer, often dubbed the peak season for sexually transmitted infections, STIs, has a history of outbreaks tied to cultural phenomena. The summer of 1967, famously known as the Summer of Love in the United States, aimed to make the world a better place, but also became a breeding ground for less idealistic consequences, namely, the rampant spread of drugs and STIs. Gonorrhea surged across the country, exceeding even World War II-era levels, and set grim historical records. While the Summer of Love quickly faded into history, its unintended legacy of public health challenges continues to echo today. In May 2024, the World Health Organization, WHO, issued a stark warning. Sexually transmitted infections are spreading rapidly worldwide. Each day, over 1 million people contract one of 4 curable STIs. Among these, the sharp rise in syphilis cases has sparked particular concern. In 2022 alone, new syphilis infections among individuals aged 15 to 49 increased by more than 1 million, reaching a staggering total of 8 million cases. Tragically, syphilis claimed the lives of 220,000 people that year. Certain countries have witnessed especially alarming growth. Japan, the United Kingdom, and the United States have all reported syphilis infection rates hitting levels unseen in decades, further underscoring the urgent need for global intervention and prevention strategies.
Hello everyone, and welcome to MedFun, a channel dedicated to exploring fascinating medical stories. In this video, we'll dig into the question, why has syphilis made such a dramatic comeback in the United States? Back in 1939, syphilis claimed the lives of 20,000 Americans. With the outbreak of World War II, both soldiers and civilians began contracting and dying from syphilis at an alarming rate. At the time, syphilis was as deadly as tuberculosis and far more terrifying than cancer. Its devastating effects included disfigurement, such as nasal collapse, insanity, and heart failure. By the mid-1940s, approximately 600,000 Americans were infected with syphilis each year. However, after the widespread introduction of penicillin, infection and mortality rates dropped sharply. Penicillin essentially cured syphilis, paving the way for the sexual revolution of the following decades. In the 1960s, societal changes coupled with the rampant spread of drug use led to record-high rates of gonorrhea infections in the U.S. In response, the government implemented a nationwide gonorrhea control program. Fortunately, gonorrhea was a treatable and non-fatal STI, as long as it was caught early. But just as gonorrhea began to retreat from the global stage, another deadly sexually transmitted infection emerged to wreak havoc in the United States. By the 1980s, the HIV/AIDS epidemic exploded, with a fatality rate rivaling that of syphilis in earlier decades. Its terrifying death toll profoundly influenced American behavior, leading many to reduce or avoid high-risk activities altogether. So, why has syphilis returned in full force today? Let's explore the factors behind this troubling resurgence. In 1995, as AIDS claimed the lives of over 50,000 Americans in a single year, the infection rates of other sexually transmitted infections like gonorrhea and syphilis also declined, reaching historic lows. However, even at these so-called historic lows, the infection rates in the United States still far exceeded those of many other countries. In 1995, the syphilis infection rate in the United States was 16 times higher than in Canada, and the gonorrhea infection rate was an astonishing 50 times higher than in Sweden. But the story didn't end there. Instead, it marked the beginning of a new cycle. As syphilis cases were brought under control, gonorrhea began to surge once again. With the advent of effective treatments and pre-exposure prophylaxis, PrEP, for HIV, making the disease far less deadly than before, syphilis and gonorrhea began to rise once again. By 2022, syphilis cases in the United States had risen to their highest levels since the 1950s. However, the patterns of syphilis transmission have varied significantly across different demographic groups and regions. Looking at trends by gender reveals a clear shift. After 2000, syphilis infection rates among men began to rise rapidly, while rates among women remained relatively stable until 2013. During this period, syphilis primarily spread among men, with the male-to-female infection ratio reaching as high as 10-to-1. However, after 2013, syphilis cases among women began to increase dramatically, By 2022, the male-to-female infection ratio had dropped from 10-to-1 to approximately 3-to-1, reflecting a significant rise in infections among women. Although penicillin has significantly reduced the threat of syphilis to adults, congenital syphilis remains a grave danger to newborns, as it can quickly become fatal. The burden of syphilis's resurgence has fallen heavily on infants. With the rapid increase in syphilis infections among women, the number of newborns with congenital syphilis in the United States has skyrocketed, growing tenfold in just a decade. During the height of the AIDS crisis, cases of mother-to-child HIV transmission were severe, but congenital syphilis cases today are more than double that number. The number of infants dying from syphilis has also increased tenfold. From a regional perspective, in 2013, only 3 U.S. states had syphilis infection rates of 8.8 cases per 100,000 people. By 2022, that number had expanded dramatically, with 42 states, including Washington, D.C., and 1 U.S. territory, surpassing this threshold. Interestingly, 2013 also marked the emergence of what is now the largest dating app in the United States, coinciding with the beginning of widespread cross-gender transmission of syphilis. Even before its debut, anonymous dating apps had already gained popularity. However, the rise of such platforms drew criticism from public health officials across the country. These apps not only facilitated anonymous encounters and high-risk behaviors, but also made contact tracing for potential infections significantly more difficult. At the time, an American epidemiologist described the situation as the perfect storm brewing for sexually transmitted infections. The combination of popular dating apps and the spread of various diseases even sparked a new market: apps designed to verify individuals as free from sexually transmitted infections. Recent data highlights a troubling trend. Having anonymous partners has become one of the most distinctive characteristics of syphilis patients in the U.S. In 2019, over 50% of syphilis cases involved individuals with anonymous partners. While this percentage slightly declined during the COVID-19 pandemic, it remained alarmingly high at 43% in 2022. From 1991 to 1992, Texas experienced a series of syphilis outbreaks that highlighted a strong connection between the disease and substance abuse. In the first outbreak, all 26 reported cases were linked to a single sex worker. The second outbreak involved 34 cases, all occurring among individuals frequenting drug dens, 3 of whom were sex workers. In the third outbreak, 50% of infected individuals had exchanged sex for drugs or money. These and numerous similar cases underline a clear pattern. Intoxication and drug use significantly impair judgment, increasing the likelihood of engaging in high-risk behaviors. Groups such as sex workers and drug users are particularly vulnerable to syphilis infection, making substance abuse another major factor in the disease's spread, alongside the prevalence of anonymous partners. In 2022, the proportion of new syphilis cases in the United States linked to drug use was alarmingly high. Among syphilis patients, 35% reported sexual encounters while intoxicated or under the influence of drugs, and 10% had partners who injected drugs. Both of these figures have risen noticeably in recent years, underscoring the role of drug abuse in fueling the syphilis epidemic.
The connection between syphilis and drug use is particularly pronounced among women. Female syphilis patients are significantly more likely than men to have histories of substance abuse, engage in sexual encounters under the influence of drugs or alcohol, or exchange sex for money or drugs. Additionally, marginalized groups such as prisoners, former inmates, homeless individuals, and migrant workers are at heightened risk of infection due to social exclusion, limited access to resources, and systemic inequalities. This reveals that syphilis is not merely a public health issue, but a complex problem intertwined with social changes, poverty, healthcare disparities, substance abuse, and societal inequality. In 1943, when most syphilis patients in the U.S. gained access to penicillin, the long-awaited cure, approximately 400 African-American men in the infamous Tuskegee study continued to suffer without treatment. The full title of this study, the Tuskegee Study of Untreated Syphilis in the Negro Male, encapsulated its grim purpose. Despite the availability of effective treatment, the study was prolonged for another 30 years to observe the natural progression of untreated syphilis. Even beyond this appalling experiment, syphilis never disappeared entirely. It lurked in the shadows, waiting for new opportunities to resurface. Over the decades, every victory against one sexually transmitted infection, STI, has been followed by the emergence of new threats. One wave often replaces another. During the peak of the AIDS epidemic in 1995, antibiotic-resistant gonorrhea accounted for 30% of cases. Today, gonorrhea has evolved into a superbug, while multiple STIs can currently infect populations, each reaching levels unseen in decades. In 2024, the U.S. Centers for Disease Control and Prevention announced the development of a new cure. However, the persistent presence of these diseases highlights not only the cunning and resilience of pathogens, but also the chaos, inequality, and recurring failures of human behavior. When freedom is defined solely as the right to act without accountability, when it permits choice without the possibility of refusal, such freedom descends into disorder. In this environment, even a cure can become a new poison. For these reasons, sexually transmitted infections will continue to write their own history as humanity finds new ways to repeat old mistakes. That concludes today's discussion. If you enjoyed this video, don't forget to like, subscribe, and leave a comment. See you next time.